Welcome to the super user update for the National Neuromodulation Registry. The data that's been collected on NNR has been summarized and giving you a view of the information we have currently on the system. The data comprises information that has been collected from when the registry first started, the 1st of February 2018, up until the 31st of March 2020. This shows you the patient characteristics that we have on the system. We have 53% of the patients who have had implants being female and 47% being male. And this is the age distribution of all the patients that we have on the system who have had implants. So we have patients less than 40 to patients who are over 79. We've also looked at the age of the patients at their first intervention. The median age is 51, and there is quite a broad spread of patients that we have. We have patients aged from less than 25 to those who are over 75. We also looked at the occupation of the patients, and it shows you the spread of the occupation we have recorded on the system for patients who have had procedures. You will notice that the highest number is 29% of unrecorded occupation information. So we do employ people to try and ensure that patient occupation is captured when they're first recorded on the system, because otherwise it's difficult to compare what the occupation is before intervention and post-intervention. This slide is showing you what the first time of intervention from refractory. So the time from refractory to first intervention, as it says, the median age is 6 years. So it's from how long it's taken the patients to get intervention from when they first realized that traditional methods were not working for them up until when they were able to get intervention using a neuromodulation procedure. We have broken this further down by the different diagnosis types. So these are the figures for SDS. We're looking at the most popular diagnoses we have, the top 10 for SDS, which that's of the pain, leg pain versus back pain being the most popular diagnosis that we have on the system up until this is the 10th diagnosis on the system that we have, that's at 2%. The 9th and the 10th have got the same breakdown. This also shows you the distribution in graphical format. The same applies to the PNS diagnosis figures. We've listed the top 10 PNS diagnosis figures, but the breakdown is which shows migraine is the most popular, and we have other being the second most popular diagnosis used. The other category is on the system which allows for manual entry. So this seems to be used quite popularly for PNS, meaning that this is one of the things that's going to be looked at by the data committee to see if we can break down what the other is and see if these diagnoses need to be added to NNR to ensure that we can actually capture what the diagnosis of the patient is. The ITDD figures are as follows. We don't have as big a spread of data for ITDD as we do for the other two procedures. SCS is by far the most popular procedure that's recorded on NNR, but this is the breakdown we have for ITDD as well. Now these are the cumulative NNR figures that we have based on full implants and trial implants. So as you can see, we have 1,420 patients that have had implants done between the 1st of February 2018 and the 31st of March. This should say 2020, excuse the figure that says 30 on there. And we have 24 trusts who have contributed to these figures and about 83 implanters on the system. The breakdown of procedures is full implants, trial implants, and revisions. And we're also showing you what the rate of follow-up is that's recorded on the system. So we have an overall rate of 96% of follow-up, which is recorded after first implant, looking at 6 months afterwards. And we have 49% of those follow-up figures being done via email. So this is where an email is sent to the patient and they're responding via the link and responding to the questions that I've asked during follow-up. We've broken down the number of implants by trust, so you can have a look and see where your trust is on the spectrum of neuromodulation procedures. The numbers in green, or the graph shows the green figures are for full implants, and the pink figures or red figures are the trial implants that are done. But the numbers are also broken down in the table below here. These are the reasons for revisions that have been recorded on the system. So we've broken them down by the number of revisions that we have as compared to the number of implants that we have on the system. So you can see we do not have as many revisions, which is a good thing, but this is a breakdown of revision reasons. As you can see, the two highest reasons, one is where no reason is recorded, and the other is the most popular revision reason that's been recorded. We do urge people to try and put down the reasons, because with the reasons we're able to do further analysis and give you better information on what the revision reasons are. So where you have other, we're going to be looking to break those down, and where you've got no reasons recorded, we do urge you to try and record reasons when you're doing revisions. This graph shows how long it takes to get from a trial to a full implant. So if you've had a patient who's had a trial, we're looking to see what is the length of time between when the patient has a trial and when they're converted to a full implant. As you can see, this on here is the width of patients. This shows sort of the volume of patients we have, and this is the interval that the most popular interval is at the bulge here. So round about, I'd say the 6 month time frame is when you have most trials converted to full implants. But you do have a few of them that might be some outliers here, but then this is the start of when the patients have their procedures done, the trial implants done. We have also looked at the difference in EQ5D scores at the 6 month follow-up. So when a patient does their follow-up, they also complete the EQ5D questions, which gives them a score, and that's been compared to the EQ5D score that has been taken prior to a procedure being done. And as you can see on here, the majority of patients seem to be improved after they've had their procedure. So there you have the mean for ITDD is 0.2, the mean for PNS is 0.1, and the mean for STS is 0.2 as well. So there is an overall improvement, which is what we want to see, the figures going up rather than down. This table shows you what the patient satisfaction is as recorded by the patients, because the patients provide information during their follow-up on how they're feeling, and we've broken it down based on procedures. So you will see we do not have as many ITDD procedures recorded, but we would hope to make sure that we get a few more over time. And this is the way the patients feel after their procedure has been done. So it's at the 6 month follow-up time that this information is collected from the patients. So this is the global perception at 6 month follow-up, done in a graphical format. And these are the numbers that correspond to the graph. We thought this would be interesting to have a look at comparing what the global score, the global perception recorded is against the EQ5D score that has been recorded for that patient. And it proved to be quite an interesting view, because the global perception and EQ5D scores do not always correlate with each other. So this is the view that we got when we compared what the EQ5D scores, the change in the EQ5D scores compared to the global perception down here. So I'll leave this on for a few seconds so you can have a look and see what that means. We will be doing individual trust reports, so we will show you these graphs with your own figures specifically, so you can see what that view is. But this is a general view of all the data that we have on NNR based on the implants that we've done since we started. Now, this is also another view to show you some of the information that you will get in your hospital reports. So we will be sending out hospital reports to all the trusts to show you what your data is and show you how that equates to the overall data in NNR. So you will have your own trust data here, and these will be the figures in NNR. So for the example that we've given here, this trust has 340 patients compared to 1,420 patients in NNR. So you can do your own calculations to see how you fare with the amount of data that's being collected. And it will be interesting for you to have a look at your follow-up figures at 6 months and by email to see where you sit in the overall comparison with all of NNR data. We're also going to give you your individual numbers, demographic numbers, against what we have in the trusts for all the NNR trusts combined as well. So we've broken them down by gender, age, employment, and comorbidity. So these are some of the things that you will have in your individual hospital reports. Your hospital reports will be more specific to yourselves, or your trust reports, should I say, will be more specific to yourselves. So you can actually look at your figures, and we would be very interested in understanding if you have any specific things which you would want us to cover, specific information which you would want us to provide in your hospital reports. One of the main purposes of having this session is to make sure that we're able to give you the information that you would like to receive based on what you input into NNR. So we would like to have some feedback from you on the presentation and also on what you would like to see. The intention is to arrange 2 sessions where we will have a question and answer session. But if you could send us your questions ahead of time, if after looking at this you have any questions or things you would like covered specifically, please email in your questions and we will put them together and possibly do an FAQ as well, and also try and arrange a couple of sessions to respond to any queries or questions that you may have. Thank you for taking the time to listen to this. That's the last slide, and look forward to hearing from you. Thank you.